Tony Marie and I would like to welcome you to this afternoon's webinar. We're both part of the Benefits Relationship Management team at CPG, where we work together with a team in New York and spread out across the United States, providing education, support, and training for CPG's products and services. We're here today to introduce Quantum Health. And first, I'll go over some of the agenda for today. So we'll be introducing Quantum Health, then CPG and Quantum Health and that partnership. Then we'll have some frequently asked questions and then answer your questions that you have live as well. So we're here today to introduce Quantum. Quantum is a healthcare navigator that excels in care coordination and other services. We have a lot to share with you today about Quantum. We'll begin with a video about why we chose Quantum for healthcare navigation, and then hear from our Quantum representatives, followed by our benefits policy team. Please be aware that today's webinar is designed to present information introducing Quantum to both members, employees, their dependents, and administrators. This webinar is not designed to handle individual, personal, or institutional health benefits issues. Please reach out separately for those types of questions. This webinar is being recorded, and as Jermaine said, will be posted on our website later next week. Tony Marie.
Thanks, Kirk. After we hear from our presenters, we're going to host an FAQ session in which we hope to highlight some of the most important takeaways and answer some of the common questions we know you have. But please know that anytime during the webinar, you can submit your questions by typing them into the Q&A section. Don't use chat. We're not following chat. Type your questions into the Q&A. And then behind the scenes, our expert panel will be doing their best to get those answered. And then, of course, there will be an open Q&A at the end. But remember that our time today is very limited. And so we encourage you to ask your questions in the Q&A function. Okay, let's watch the video.
At Church Pension Group, we've been administering healthcare plans for the Episcopal Church for over 4 decades. So we know that healthcare experiences can be difficult, complex, and sometimes frustrating, just annoying. I'm really pleased to announce that we've identified a solution to simplify and really improve our members' healthcare journeys. The Episcopal Church Medical Trust has contracted with Quantum Health. Quantum's a leader in care coordination and navigation of healthcare services. They're going to serve as your single point of contact for all your healthcare needs. Starting January 1st, Quantum Care Coordinators, so think of nurses, other healthcare specialists and experts, claims specialists, they're going to step in and help you make the most of all your benefits, your medical, your prescription drug, your behavioral health benefits, and really put you in a position to achieve better health outcomes. Our medical plans for active employees and their dependents will continue to use Cigna and Anthem Blue Cross Blue Shield networks, and Express Scripts will still administer prescription drug benefits. So what that means for you and for others is there's no change there. You'll still be able to use the same doctors that you currently use. All active members and their dependents will continue to have access to the same network of providers. So no changes on that front. In addition, we'll continue to offer group Medicare Advantage plans for retirees through United Healthcare. But Quantum will now step in to help manage the complexities of caregiving at that stage of life, including things like finding the right nursing home and addressing related legal and financial concerns.
Instead of the hassle of trying to coordinate from multiple vendors and multiple providers, you have one place to go and one team that is ready and willing to help you with your healthcare experience. Quantum's care coordinators will be your advocates for a better overall health experience. It can help guide you to preventive services to keep you healthy, but more importantly, it will work with you and your provider to navigate through the healthcare system when you get sick. They can also help with the blocking and tackling, which is seen in healthcare quite a bit, such as finding specialists, answering claims and billing questions, explaining co-pays and costs, and also assisting with pre-certification and much, much more. But it's important to know that the Episcopal Church Medical Trust will also be there to answer your questions as we remain the plan sponsor of your health benefits. You can connect through Quantum by phone, my CPG account, or via the Quantum app. But also your dependents can access through quantumcare.org. Quantum is all about making your healthcare journey smoother, less complex, but also very efficient. We believe Quantum Health will enhance your healthcare experience, ensuring you receive the right care in the right place at the right time. Here's to a healthier future.
Now I'd like to introduce you to our partners from Quantum Health, Vicki, Jen, and Kathleen. Kathleen, I'm turning it over to you.
Welcome, everyone. My name's Kathleen Stevens, and I have been with the Quantum team for almost 9 years, and I will be a strategic extension of the trust. And I'm very excited to be here, and I really love that video. And I'd like to introduce you to my team. I'll start with Vicki Uten.
Hi, I'm Vicki Uten. I am the client manager. I've been with Quantum for just over 13 years, and Kathleen and the pod manager and I, we all work very closely together in supporting the pension group's plan and their day-to-day activities. Jen?
Hi, everyone. My name is Jen Parmenter. I am a senior pod manager with Quantum Health. Been with the company for about 4 years, and it is my team that is really excited to serve all of you.
Thank you. All right, so Quantum Health is the pioneer in healthcare navigation, and we're going to spend time discussing who we are and how the Quantum team is going to serve you and the best ways that you can connect with our team. So Quantum Health Navigation was created by our founder and chairman of the board, Miss Kara Trott, 25 years ago in Columbus, Ohio. Kara is an attorney and a consumer research expert. Kara was working on a consumer research project for a large hospital system and realized that the complexity of the healthcare system is really complex, very confusing, and recognized that consumers have a lot of choices and decisions to make when they're going through a healthcare journey. When we developed the service model, it was to simplify the experience by creating a dedicated team of experts who are going to help guide you through simplistic and complex healthcare decisions. So think of the Quantum team as an extension of the medical trust, and we are great listeners. We are experts in all the benefits that are available to you, and we can connect you to the right care. We are simply here to reduce any anxiety and any burden that often accompanies healthcare and healthcare decisions. So think of Quantum as a gateway to care by our team, who are going to provide an empathetic ear to understand your needs and connect you to the services that will best serve you on your healthcare journey. And it's important to note that we welcome all of your calls and all of your questions. So I always tell people, when in doubt, call Quantum Health.
Great. So like I mentioned, it is my team that has the pleasure of supporting the CPG membership, and we will be available to start that support on January 1st in the new year. We will support you with many things, but some things as simple as needing an ID card or helping you locate a quality in-network provider, or just educating you on everything that's available to you via your healthcare benefits. We're really excited to be supporting you and to meet you and to help you through all of your healthcare needs. We're really uniquely positioned to have access to the benefits that you enrolled in during your open enrollment. They're available right at our fingertips to be able to help you in real time when you reach out to us. We will have access to your medical and your pharmacy claims to be able to help you through any questions that may arise or any support you might need with either of those things. So I'm excited to give you a peek into what this team that is here looks like and how we're able to really help you out. We are located in Dublin, Ohio, which is just outside of Columbus, Ohio. Go Bucks. We offer a gifted team that is really dedicated to about 200,000 faith-based member lives. Our pod consists of about 65 dedicated members who are very well versed in your benefits package. Our pod has 3 components, as you can see on the screen in front of you. We have pod leadership, we have a nursing staff, our clinicians, and we have customer service representatives. What makes us unique is that we have clinical support within our pod to be able to support you in real time. We handle your prior authorizations, your clinical reviews, and we're there for person-to-person support for those that need it. So one of the key reasons that CPG chose to partner with Quantum Health is for our extensive clinical support. We offer key areas of expertise by specialty clinicians to make sure you're able to receive the highest quality care and have an excellent experience. We help support members by eliminating gaps in care, removing obstacles to care, and supporting you and your family who may have complex healthcare issues by providing clinical support, including but not only limited to oncology management nurses, transplant management nurses, pharmacy management nurses, and high-risk maternity and NICU management nurses.
Like Jen mentioned, there's a lot of opportunity to engage with the pod. And sometimes people get stuck and are curious, like, what do I do? So I always tell people, when in doubt, call Quantum Health. We're here to support any and all of your healthcare needs. So Quantum Health was very intentional in making this a very simplistic experience. And the reason why we did that is because you probably have a lot of things to manage in your life. So we made it easy. So we have one phone number that's just dedicated to you all. So when you call the number on the back of your ID card, you will reach the pod. We have one app that's available with to support your any self-servicing needs. And you have one team of experts that are dedicated to helping the medical trust. So the Quantum Health Pod is unique because we want to talk with you. We are excited to talk with you, and we welcome our members to take as much time as necessary to talk through any needs you might have.
All right, beginning January 1st, you will all have access to the Quantum Health member portal, and at that time you can register, and you can do that registration either via your desktop or accessing it on an app, downloading the app and doing it that way. Once registered, then you will have full access to all of your health plan benefits, which includes easy access to your ID card, which you can either download that ID card, order additional cards, save it to your wallet, or even fax it to a provider if you happen to be in the office in real time. You will also be able to search for in-network providers, check your healthcare cost, get up-to-date information on medical claims, and check deductible status and out-of-pocket status. And then you can also chat with the care coordinator during our regular business hours, which is 8:30 a.m. to 10 p.m. So you can chat with the care coordinator if you have any questions. Send a secure message, which will then be returned within about 24 hours. Or you can even schedule a time for a care coordinator to call you back when a time that might be convenient for you. There's a lot of information for you available on the member site. In addition to the things that I just mentioned, you'll also have a document library or a library of health benefit inquiries and things like that, where you can like look up things that you may be important to you that are specific health topics, but you'll have a whole library of those types of things that are available to you in addition to all of your plan benefits.
I wanted to mention one more thing that is important to note, that at some point you may receive a call from the pod. And it's usually a clinician or a patient service representative reaching out to support you. And so one of the things that's important to note is when use the number on the back of your ID card to contact the pod. So like I said, when in doubt, call Quantum, but how you access that phone number is on the back of your ID card. And then the other thing to consider is if you speak with one of the clinicians, save the nurse's phone number on your phone to make sure that communication is simplistic, and it will reduce any and all concerns that you might have about someone scamming you or reaching out to you inappropriately. We know that this is a great time saver. And, when you're going through a healthcare journey, you don't need to worry about anything else. So just make sure you think of that when you make outreach. And I just wanted to say we can't wait to talk with you, and we're really excited for the opportunity. And so I'll hand it over to Anthony.
Thank you, everyone from the Quantum team. My name is Anthony Coda. I'm Vice President Policy and Plan Administration with the Benefits Policy team at the Church Pension Group. Been with CPG for over 12 years and really excited about this new enhancement to our health plans. Just quickly, I just wanted to thank everyone for really taking the time out of your busy day to join us today. To discuss Quantum in detail and really provide us with the opportunity to answer any lingering questions you may have in this transition. Although we hope everyone's experience in navigating what we all know is a complex healthcare system will become easier through Quantum, really with everything we do through the medical trust, our number one focus is on improving everyone's health. And that's really through timely, effective, and high quality care. Before I go into some plan enhancements for 2025, I wanted to provide additional details regarding Quantum as it relates to CPG and our benefits. First, Quantum is only available through plans with this Anthem and Cigna networks. For members, if you happen to be on this call and you're in a Kaiser plan, an HMSA plan in Hawaii, or enrolled only in a dental or only in the employee assistance plan, Quantum services are not available. For services for these plans, members can contact those plans directly or reach out to CPG's client services team for additional support. Next, and this point may answer a few questions for many of you, members will still be able to contact and go to their medical providers directly for services. You do not have to call Quantum if you need to set up an appointment to contact your provider. You could go directly to them for services. And then lastly, as of January 1st, the services of Health Advocate will no longer be available, as Quantum Health is going to be taking over all those services. We are working with Health Advocate to complete any open cases by the end of the year. And if there are any still open, and if necessary, we will continue to work with Health Advocate to transfer these open cases over to Quantum to do our best to ensure that members have a care coordinator by their side through this transition. We're going to touch upon new enhancements to our medical plans. But before I do that, just wanted to kind of plug some of the great programs we currently have, such as Hinge Health, which offers digital exercise therapy. And I mentioned before our employee assistance plan with Cigna. Beginning in 2025, both the existing solutions within our plan and the new enhancements I'll be talking about will be streamlined within the Quantum experience. So members won't need to remember different phone numbers or the details of those programs. As Quantum was mentioning before, you could simply reach out to Quantum and they will guide members through the different available options within the plan. On this slide, we're just going to discuss a few of the newer features for 2025. First, Teladoc Health Services. Teladoc Health Services will replace Live Health Online and MD Live telemedicine platforms currently with Anthem and Cigna. Teladoc is a fully integrated virtual care platform that can be accessed directly through Quantum's website, their app, or a call to a care coordinator. Teladoc goes beyond urgent care support and offers primary, chronic, specialty, and mental health services, all seamlessly accessed via Quantum. Also, one really cool thing is that there are no member out-of-pocket costs when utilizing Teladoc services. Next is Magellan Healthcare. As many of you know, both nationally and within our plans and our population, the utilization of behavioral health services has increased, especially since the pandemic. To ensure that our members in need continue to receive the best care possible, we are introducing Magellan Healthcare. The care managers at Magellan will work with members to help them successfully address their mental health needs. This can be accessed, again, fully integrated through Quantum. And Magellan's core services include outreach to individuals, especially while they're undergoing inpatient, residential, or outpatient treatment. Magellan care managers work with patients to support continuing care plans, including prescription and follow-up visit adherence, and provide education, support, community resources, such as access to support groups, again, within the community. And lastly, through Quantum's personal oncology management, the Medical Trust is looking to provide members and their treating oncologists with support from renowned oncologists who specialize in all types of cancers, including rare and complex cancers. Their support will include comprehensive case review, advice, and guidance on items such as tests, labs, and treatment. And this is all done through a clinical collaboration between the reviewing expert and their treating physician. So again, with this service, we're not telling members or asking members to change their physician. It's an enhancement where their physician could work with these renowned oncologists to develop a care plan. Okay, I will now discuss important information on medical ID cards. All Anthem and Cigna network enrollees will receive new ID cards. The new ID cards will have a new member number and group number and everything that will be needed for pharmacy benefits. 2 IDs are going to be sent to everyone, and the subscriber's name and their dependents will appear on all the cards. Additional cards, perhaps for college students living outside the home, may be obtained by calling Quantum and will also be available digitally through the Quantum app and their website. Beginning January 1st, all members must use the new ID card to access medical, prescription, and behavioral health benefits, and that includes the EAP services. Old Anthem and Cigna ID cards will not work after December 31st, 2024. So again, be on the lookout for those new cards. Okay, so if you are a member and wondering what to do next, here are some key takeaways. I'll reiterate it. Again, if members should continue to look out for your new card. It should be coming, I don't want to say within any day, but certainly prior to January 1st. This ID card, again, will contain everything needed to obtain medical and pharmacy service, and also includes Quantum's contact information. Beginning in January, members should ensure their pharmacy and any providers have the new card on file. And this will help avoid any issues with claim processing or verification of benefits. Again, if those issues do occur, you could always reach out to Quantum to hope to get those resolved. And then starting in January, members may register and sign up with Quantum, and subscribers can do so by accessing Quantum via their MyCPG account. All right. next, this is a breakdown outlining when it's best to call Quantum and when to call CPG Client Services. We talked about the Quantum items earlier, but this will provide a little bit of a refresher. It's always best to call Quantum directly if you need any help in replacing ID cards or requesting additional ID cards. If you need any help in finding in-network physicians, hospitals, or facilities. If you need to verify coverage and if necessary, get a prior approval or even check on the status of a prior approval or pre-certification. To review the different care options in your plan. Again, don't have to remember everything that the medical trust offers. Quantum will have that at their fingertips to be able to guide members. If you need to prepare for a hospital stay. Also, sometimes you need help in contacting and getting in touch with doctors to coordinate treatment. Additionally, you could potentially save on out-of-pocket costs. Again, I mentioned like telemedicine or other maybe more efficient care options, and Quantum will guide members when that is most appropriate. And then also to resolve any claims or billing issues that may arise through the course of enrolling in our plans. From a health plan perspective, CPG Client Services should be contacted directly if members have any questions on eligibility for employees and their dependents, and any support with their MyCPG account, including enrolling in a plan. If anyone has any questions on any of the other benefits offered through CPG, such as pension, disability, or life insurance, they should still contact CPG Client Services team. And lastly, CPG Client Services should also be contacted for any administrative support, including billing questions. Okay, as you can see here, there are several ways to engage with Quantum. Remember, and we heard it in the video, for your healthcare, Quantum is your one place to go with one team to help. So again, starting 1/1, members will no longer call Anthem, Cigna, or Express Scripts directly with any benefit or claims questions. They should reach out to Quantum instead. To contact or access Quantum's dedicated team, please, we mentioned the phone number before. Members can call 1-866-871-0629. And just to repeat, their hours are Monday to Friday, 8:30 a.m. to 10 o'clock p.m. Eastern Standard Time. And starting 1/1, subscribers can log into their MyCPG account, where they can then access Quantum and create an account for future access. Could also visit myquantumcare.org, where eligible spouses and dependents can set up their Quantum accounts directly. And then also use the app, which is named Quantum Health, and that's available in the Apple App Store and through Google Play. Digital ID, again, I'm just going to repeat, digital ID cards, the member website, and the mobile app will be available starting January 1st, 2025. Some of you are probably familiar with this information, but we just wanted to put it on the slide, and again, which will be shared. But here is the contact information for the Church Pension Group Client Services team. We are available Monday to Friday, 8:30 a.m. to 8 o'clock p.m. Eastern Standard Time. Members can call directly at 1-800-480-9967 or email mtcustserve@cpg.org, and administrators can call 1-855-215-5990 or email admin-assist@cpg.org. Now I will pass it to Kirk Mason and Tony Marie Sutliff. They introduced themselves, but they're my colleagues within our benefits relationship management team, and they're going to go through some key takeaways and frequently asked questions before we open it up to answer any of your questions. Thank you.
Great, thank you, Anthony. Yeah, Tony Marie and I are going to try to answer some of the questions. Many of these have been popping up in the Q&A, so we will try to respond to some of those. And just a clarification, we will not be able to respond directly to questions that we do not get to live during this presentation, but we are making notes of those, so hopefully be able to provide additional information at a later date. So Tony Marie, I've seen a lot of questions about this one. When am I going to receive my new ID card, and how can I make sure my providers have the correct insurance information?
Well, and that is the primary key point from this whole conversation, is that you will get a new ID card, and it should arrive by the end of this month. You should have it in your hand on January 1st. However, if you don't, if for some reason you threw it away or the mail got lost, we know that this time of year is really busy in the mailroom. If it's gotten lost, you don't have it, you can't find it, you can contact Quantum and get a new card. Or if you need a replacement card down the road, you can contact Quantum. Remember, one of the most important things to know is that you can contact Quantum for all of your questions, including getting a new card. Or beginning on January 1st, you will have access to the Quantum app. And through the app, you can get a digital card, which will always be there for you. Now, the second takeaway for you today is that all of your providers need to have this information that's on your new card. And let me step back and say, it is not a new medical plan. Whatever plan you're enrolled in is not changing. This is just a new benefit on top of your plan. However, because of the way Quantum operates, you will have a new ID number. So when you get your new card, contact your providers, your doctors, those sort of things, and give them the new information. They may ask you, has your plan changed? No, the benefits have not changed, but the number has changed. And all of that information for your doctor, for the billing people, is right there on that card. So they need to have that information. One small caveat is about pharmacy. If you go to your local pharmacy, you need to make sure that your pharmacy has your new card so that they bill appropriately for your medications. But if you get your medications from Express Scripts through the home delivery program, that information is being transferred in the background. So you don't need to give that information to Express Scripts. Kirk?
Thanks, Marie. I do want to make one clarification. So if your doctor asks, do you have new insurance? The answer to that is yes, I have a new insurance number, and here is my new number. You will still be in an Anthem or Cigna network, but you do have new insurance number that you need to provide to all your providers. So, right. Does my new card cover all my benefits?
No, as Anthony said, it does not cover your dental. So you keep your dental card and you make sure your dentist has that information. So Quantum does not cover dental. For vision and EAP, it's a little bit different. You can always call Quantum if you're having trouble understanding your vision benefits or finding a vision provider. Quantum can probably help you, but you can just go right to the EAP, or I'm sorry, to your vision on our website, to the information there if you want vision. For the EAP, the benefit is not changed. It's still part of your medical plan and you can take advantage of it like you do, but you'll actually get more benefit for your mental health services if you call Quantum first. It may be that using the EAP is exactly what you need to do and Quantum will help you get into that system. Or it may be you need something else other than the EAP and Quantum will be able to help you there. So not dental, vision and EAP, yes, but with some nuances.
Good, thanks, Marie. How can I make sure that my prescription medications are covered and delivered with no disruptions?
Again, your first call is to Quantum. So call Quantum. They'll have your records. They'll know what prescriptions you're on. And if there are any background questions, they know how to go around the system and figure out what's going on with you. Great coordination between Quantum and Express Scripts, for example.
Great. Thank you, Marie. So when I give my doctor my new ID card in January, what do I need to tell my doctor when I visit with them?
Mostly just that your plan is not changed. Your benefits are the same. So whatever the doctor is used to and you are used to doing with regard to the benefits that are covered by your medical plan, that is not changed. The front office needs to know that you have a new number and new information on how to submit the bill so that they make sure that the bill that the doctor's office is charging goes to the right place and gets paid. Your number is changing, but not your benefits.
Great, thanks, Henry. So I still have a question about vision. How does Quantum help with my vision benefits? If I use the iMed app on my phone, can I still use that one?
Absolutely, you can still use that one. If you're having trouble finding a provider that you can access through the app, you might call Quantum, because remember, Quantum is your one number, and they will be able to help you, whatever your question is. But use your iMed app if that's what you're used to using. That will still be available to you.
Good, thank you. What if my doctor's office doesn't know anything about Quantum?
Really, they don't need to know anything about Quantum, except that the information that they need to know about how to submit their bills and a phone number to call if they have any questions is on your card. That's really all they need to know. However, to make them feel better, they could call Quantum directly, identify themselves as a provider, and get all their questions answered.
Good, thank you. So what makes Quantum different from Anthem or Cigna?
They're really two completely different ideas. Anthem or Cigna are the networks that we use through the medical trust plan to give you access to providers. If you're on an Anthem plan, you're using Blue Cross Blue Shield network providers. If you're on a Cigna plan, you're using Cigna network providers. And they are the providers that provide you with the benefits that are covered under your medical plan. On top of all of that, this is an extra service that's going to be provided by Quantum to help coordinate care across different providers, for example, or to answer your questions, just to make sure that this whole very complicated medical and medical insurance system in our country makes sense, because it doesn't. To help you get your questions answered, your concerns responded to, your issues resolved. That's what Quantum is going to do. So it overlays everything else, but the underlying networks and benefits are not changing.
Right, thanks, Henry. I know Anthony talked about Health Advocate and if I've got a claim or a billing issue, but if I'm working with Health Advocate now on a claim or billing issue, what happens in January?
Health Advocate is working really hard, and they're working with us actually to make sure that any existing case that they have right now, they'll be able to finish by the end of the year. But of course, there will be some that will not be finished by then. So Health Advocate is working closely with Quantum, and we're going to be monitoring that to make sure that there's an appropriate handoff of the system over to the Quantum pod so that they can pick up and keep going without any break in service.
Right, thank you. So I'm in the middle of treatment, and now I'm hearing that my insurance numbers are changing. That worries me a little bit. So what should I do to avoid any billing or coverage issues?
Really, the best thing to do is to call Quantum and tell them your concern. They'll have access to your information. They'll be able to tell you that things are proceeding apace and smoothly. And if it looks like there is any kind of a glitch, they will know how to fix it. So really call Quantum, let them know what your concerns are, and get your questions answered.
I want to thank everyone for joining us. Jermaine, I think you have some parting announcements.
Yes, we do have a brief survey. Thank you, Kirk. We have a brief survey. So please, as you exit, answer the survey. The survey will help us know what you need going forward in the future from our webinar offerings. Thank you so much for joining.